My name is Dr. Shannon Klump, and I'm a family medicine specialist. I went to medical school in Arizona at the Arizona College of Osteopathic Medicine. I wanted to be a doctor since as long as I can remember. When I was in kindergarten, everybody was asked to draw a picture of themselves in the future, and I drew myself as a physician. It was just something I worked towards that whole time. I had a brother who was sick when I was in late elementary school, and that just helped to solidify my desire to be a physician. I selected the specialty of family medicine because I like a whole variety of things. I love taking care of children, I love taking care of adults, and I love taking care of the geriatric population. It gives me a lot of variety. I never know what's going to present the day that I'm in the clinic. I could get a cough and a cold, and then I can get something very complicated. I knew that I needed variety to enjoy medicine. As a family medicine physician, I really see everything from wellness visits, physicals, to acute visits. I manage long-term chronic diseases such as diabetes, asthma, COPD. As an osteopathic physician, I really try to practice in a holistic manner, taking into consideration the patient's mind, body, and spirit, and how each of those components affect their health. I also perform quite a bit of osteopathic manipulative medicine in my practice, and this is hands-on treatment for musculoskeletal problems. I grew up in Colorado. I lived both in rural Colorado and in downtown Denver, and kind of just varying times of my young life. I went to medical school in Arizona, and after medical school I joined the Air Force, and my first duty station was San Antonio. We were there for 3 years, and then we were lucky enough to get stationed in Germany, and while we were in Germany we spent a lot of time thinking about where we wanted to live. We had been to Fredericksburg quite a bit when we lived in San Antonio, and I just fell in love with the hill country. And that's how we ended up in this area. I started with Peterson Medical Associates this past August. The support from leadership, from fellow physicians, and from all of the staff members makes this a very special place to work. It's just been a fantastic and supportive place to be. The best thing about living and working in the hill country is just, the quiet lifestyle that we're able to lead, the ability to really connect with people, both in your personal life and in the practice of medicine. You become a part of people's lives in medicine, and it's not so busy that your doctor is just kind of another appointment that you have on your checklist. As far as being in the hill country, personally, it's just beautiful. People are friendly, they're warm, welcoming, they're very genuine. When I'm not at work, I like to spend time with my family. My children are now grown up, so it's a little bit harder. I also spend a lot of time in my garden. I love the challenge of learning the different seasons that we have here in Texas and being able to grow something in the garden all year round. Currently, I'm growing in my garden tomatoes. I had this summer some experiments with some different types of vegetables that I hadn't heard of before. I grew some Armenian cucumbers that were fantastic. I'm trying to master growing squash. We have squash borers in our yard, which can make squash growing quite a challenge, and I've discovered a couple of different varieties. One is an Italian squash called a tromboncino, and it grows long and skinny, and it's a really fun squash, and it fills all the recipe bullet points for squash. I love Peterson Health because of the opportunity to take such good care of people.